Okay, it is 6 o'clock now, so we're going to go ahead and get started so that we can keep ourselves on time. So good evening. Welcome everyone to the Health Insurance Education Series. This is a three-part series hosted by UIC Division of Specialized Care for Children. We've had 2 other sessions. This is our last session of the series, and we focused on a different topic each month. So tonight we're going to focus on health insurance appeals. We're going to just jump right in. Okay, so my name is Brittany Provost. I'm the manager of our benefits management and research team here at DSCC. We work with DSCC care coordination teams to help solve insurance problems. So if you are with DSCC and you talk to your care coordination team and you bring them an insurance problem, they usually come back and talk with us and try to get some guidance on where to go with it or help get the issue resolved so that you guys don't have billing issues or insurance issues that you're experiencing. So I have 2 other BMR team members here with me tonight. I have Amy Edwards and Renee Woodson, and you're going to also hear from them throughout the presentation. Some housekeeping before we get started with our content. Captioning is available for the presentation, so you should see that button at the bottom that says show captions. If you want to click that, you can turn the captions on if you want to see them. ASL interpretation is also available, so you should be seeing that happening live. All attendees are muted. You were muted when you joined the presentation, so you can use the raise hand button or the Q&A button to ask a question. We prefer if you can use the Q&A button to ask a question if you need. That way we can read it while the presentation is going on and respond if we can. We may save some questions for the end of the presentation if they need to be answered a little bit more in depth. But if there's a question that you want to ask that you can't put in the chat or you'd rather ask it out loud, you can use the raise hand button and we can unmute you, but we'll save those kinds of questions for the end of the presentation. And you'll notice that the chat has been turned off. You can't type anything into the chat. You can only use that Q&A button. And for anyone that is Spanish speaking, we're also going to be offering this presentation in Spanish on Thursday night. So if that's a more comfortable language for you, you can tune into that presentation on that night too. We are recording the presentation, and the recording is going to be posted on the website with the other materials for the presentation. Because it's being recorded and because other people are listening in today, we ask that you don't share any personal information when you're asking questions, whether you're typing it into the Q&A box or if you get unmuted and are asking a question. We just want to make sure that your personal information stays private. You can email us afterwards if there's something that you want to talk about a little bit more specific that might require you to share personal information. We can set up a time to talk. We've done that after other presentations with other people that had more specific questions that they wanted to go into more detail about. And we will email the slides to you after the presentation, and they're going to be posted on the website. So after the presentation tonight, you're going to get an email from Zoom in the next couple of days. I can't remember exactly how long after the presentation it sends it out, but it's sometime within 48 hours after we present, and it'll have a link to our website, the Family Education website, where all the information is going to be posted. So it'll have the recording, any related materials, and you'd be able to see all the stuff from all the previous webinars that we did there too. So our agenda for tonight is just a brief DSCC overview, and if you've been on all the other presentations we've done, I apologize, that's a repeat, but if there's anyone new that's joining us, we just want to make sure everyone's aware of who DSCC is and what we do. We'll talk a little bit more about what an appeal is, the steps for an appeal. We're going to kind of go step by step and talk about the process and what you can do at each step of the process to have a more successful appeal. And we'll talk about how to write an appeal letter and provide a lot of examples. We actually have an example appeal letter that we're going to walk through, kind of how to write the letter, what information you need to include, and kind of share some resources for that. Okay, so the little introduction to DSCC for anyone that's new. Our vision is that children and youth with special health care needs and their families will be the center of a seamless support system that improves the quality of their lives. Our mission is that we partner with Illinois families and communities to help children and youth with special health care needs connect to services and resources. DSCC provides care coordination services through 4 different programs. We have our core program, which is for ages birth to 21 with medically eligible conditions. We have our Connect Care program, which is ages birth to 21 with special health care needs who are enrolled in a Medicaid Health Choice Illinois plan, a Medicaid managed care plan like Blue Cross, Meridian, that's contracted with DSCC for care coordination services. We have our home care program, which is for children or youth in need of in-home shift nursing. And finally, our interim relief program, which is for children with eligible mental health or behavioral disorders. Okay, I'm going to turn it over to Renee to kind of jump into what an appeal is.
Thank you, Brittany. Good evening, everyone. We're going to jump right into what is an appeal. So an appeal is when you ask your health insurance company to reconsider their decision. So the health insurance plans are required to tell you why they did not cover the service. So you won't be wondering, you'll get a letter from them and you'll probably get a bill letting you know, hey, you owe this, which will in return let you know, hey, why didn't they cover this? So, yep, that's how that'll work. You'll get notification of why they didn't cover the service and what they did cover and what they didn't cover, which we'll go over a bill or an example of one a little bit later on in the slides. So just know you have a right to appeal with your insurance. And so we're going to take a step-by-step, we're going to show you the step-by-step process. And taking it step-by-step will make it a little less overwhelming, because if you've ever had to file an appeal, you know it's a lot of work. But this, taking it step-by-step, will make it a little bit less difficult for you. And you know, when you take small bites, it's better. So, all right, again, remember that it is your right to file an appeal. So, first step, know your insurance plan. Second, understand the denial. The third step, know your rights to the appeal, to get an appeal. Number 4, make sure you gather your documentation. Number 5, write an appeal letter. And 6, submit the appeal. So we're going to go through those steps tonight. Okay, why should you file an appeal? Again, it's your right to file an appeal. When a service that you need is denied, don't just take no for an answer. You can appeal that. Don't just think, oh, well, I guess I'm going to have to pay that out of pocket. No, ma'am, you can file an appeal. And sometimes that's the only way you can get the services that you need covered is through an appeal. Now, who can help you with this appeal? First, we're gonna, yes, okay. Who can help you with this appeal? Your health insurance plan, number 1. Call your health insurance plan. Find out how your health insurance plan works. Find out what it covers, what it doesn't cover. You can find out, sometimes it could be as simple as the wrong code was used, or they maybe filed it on the wrong insurance claim, on the wrong claim, medical claim. So it's talk to your insurance plan. Who else can help you? Your doctor or your provider. Talk with your doctor. Find out if there is anything else they could provide. You know, your doctor can provide the letter of medical necessity. What else? The doctor may know other options that you can use. Other things the doctor can assist you with and getting and filing your appeal and being successful in your appeals process. Social worker. Most hospitals have the hospital social worker. They can usually connect you with the right people to help you to get what you need done. If you need some assistance in filing your appeal, if you need further information, if you need information from a specialist or something, a social worker can usually connect you with the resources that you need. course, if you're enrolled in DSCC, your care coordination team will be able to help you with your appeal. They can't file it for you, but they can assist you. They can assist you with getting information from your health insurance. They can help you to understand your health insurance, and they can help you with your appeal. Illinois Department of Insurance, Illinois Attorney General also can help you with your appeal from the beginning to the end. And it's also a good place to file a complaint if you have further issues, something that the insurance company did incorrectly, or something that's going on with the billing. Illinois Attorney General, Illinois Department of Insurance should be able to help you with those things. Okay, we have a little case study here, an example, and we're going to use Patrick. Patrick James is, well, sorry, James Patrick, I think, Patrick James. Okay, he's 5 years old. He is autistic, and he needs to get the ABA therapy. He needs applied behavioral analysis. That's what his doctor has prescribed for him. Okay, mom has Aetna. She has a private plan through her job. The plan is a health maintenance organization. It's an HMO. Again, remember the first step is knowing your insurance plan. So know the name of your insurance, know what type of plan you have, whether you have a HMO or a PPO. That's important because remember with an HMO, it's restricted. It's more restricted. You only have in-network benefits. You don't have any out-of-network benefits. So remember that. Okay, review the health benefits handbook, and also known as a member handbook. If you don't have one, you can call your insurance company. They can send you one. You can also go online to the member portal and you can download your handbook or just look at it from there. Okay, also talk with your doctor. As I said earlier, talk to your doctor or provider about the needed services. They may have other options. The doctor may have more information. Sometimes there's other treatments you may need first before an insurance company will say, okay, we'll pay for this other procedure. Did they try this other procedure first? Okay, they have to do this one first. Then if that one doesn't work, then next procedure. Also, your doctor can explain why this is the procedure that was denied, why this is the one they need. This is the one they have to have. So talk to your provider. Okay. Now, also some insurance plans need you to get a referral. HMOs are like that. You usually need a referral to see a different physician. If you need to see a specialist with an HMO plan, you're gonna have to get your primary care physician to give you a referral to see a specialist. You may need to get a prior authorization. Sometimes a prior authorization is needed before the plan will pay for anything or cover anything. They want to get this approved beforehand. And then again, with the in-network doctors, remember, HMO plan does not have out-of-network doctors. So you need to know and make sure that you're using doctors that are in network. It'll be less expensive for you. Okay, let's talk a little bit about the costs. Okay, premiums. The premiums is the amount you pay each month for your insurance. Now, if you get your insurance through your job, you're not going to pay usually not a real large premium because your employer pays some of that. Okay. A deductible, the amount that you have to pay before the insurance plan starts to cover the service that you need. Coinsurance is the percentage that you have to pay. Say, for example, if you have durable medical equipment, if you need some DME equipment, and it's covered at 80%, your coinsurance is 20%. So if you have a piece of equipment that's billed for $100, your insurance is going to pay 80. You'll be left to pay the other 20%, which would be $20. Okay, a copay. Your copay is a set amount that you pay for a covered service. For example, $20 for an office visit, $30 for a specialist visit. Now, copay is usually, like a keyword, is set amount. It usually does not change within that plan year. Now, when you go to the next plan year, the next year, it may go up a little bit. So I've seen where a copay was $20. Then the next plan year went up to $25. So it can vary after the plan year, but during that plan year, it won't change. Out-of-pocket maximum. That's the most that you'll have to pay out of your pocket for covered services in that plan year. Okay. What is a bill? And then also about your out of pocket real fast, I want to let you know that sometimes the out of pocket may be $3,500, maybe $5,000. But once you meet that deductible and you've paid that out of pocket, usually your plan will begin to cover your service at 100%, but you have to make sure you've met the deductible and that out-of-pocket max. Okay, what is a bill? Most of us know what a bill is. We get them, don't we? But anyhow, this is what a bill looks like when you get a statement from the doctor and you've gone to the doctor. This is just an example of what your bill could look like. It'll have your name, of course, where the bill is coming from, your date of service, your balance, and what you owe, what the insurance plan paid. So just kind of, you know. Okay, now this is your explanation of benefits, also known as an ELB, and this is understanding your explanation of benefits. And this is important that you keep this paper. You'll need this when you're filing an appeal, so you'll have detailed information. It just breaks down your bill, what they covered, what the charge was. Again, it gives you at the top customer service phone number. So if you have a question, please, by all means, call them. Ask your questions, and it'll help you, and make sure you document every time you call and document exactly what they said, document who you spoke with. Okay, it'll have a statement date, it'll have your document number. It'll usually let you know that this is not a bill. This is just an explanation of what was charged and how much they paid. It should have the provider's name there. It should have the date paid, claim number. And then down, and that's in the middle, close to the middle section, it'll have the claim details. It'll have the date of service. It'll have what the provider charged. It'll have the allowed amount. It'll have if you made any co-pays, anything like that. It'll also show you what the insurance provider, what they paid, what your insurance company paid. And yeah. And just usually, again, it'll just show you what you would be responsible for and what was charged and what everybody else paid.
Hi, everyone. My name is Amy, and I'm glad you could join us tonight. We're going to talk about step 2 now. And step 2 is understanding the denial. So an important step before the appeal is to understand why your health insurance plan said no to a service. It's important that you understand why they denied the service or said no to it, so that this will help you with building your appeals case. Your health insurance plan will usually send you a letter that says why the service was denied. This can happen before or after a service is received. You may also look at an explanation of benefits, often called EOBs, and this will show you the information about a denied service. These are always sent after a service has been provided. All right, let's talk about common denial reasons for from your insurance company for a service. So sometimes it can be a mistake or an error. This happens when a provider made a billing error, and this can happen more often than not. This usually can be fixed by calling your doctor's office or the medical provider and asking them to review what they submitted and resubmit again. It can also be denied because a pre-authorization was required and you did not get one before the service. It is always important to ask your insurance company before a service if a pre-authorization is required. Your doctor's office will usually help you with this, but it is important that you confirm this. You can be denied if the health plan does not feel that a treatment or procedure is medically necessary. This is also a very common denial reason. Your health plan will review the service you want to receive or already have received, and they will decide if it was medically necessary for you. Sometimes this can be fixed by having your provider submit additional documentation to the health plan showing why this certain procedure was necessary. Certain prescription drugs can be denied if they are considered off formulary. A formulary is a list of medications that your health plan will cover. Your insurance plan wants you to use medications that are covered on that list. And if there isn't a medication on that list that you are needing, sometimes you can get this approved if your doctor provides enough justification and reasoning showing why you need to be on that specific medication. You may be denied by your health plan if you are trying to receive or if you've already received care that is out of network. Some plans, like an HMO, do not have any out of network benefits, so they will deny any services that you get or try to get that are out of their network. Lastly, you may be denied if a service is not covered by your plan at all. You may be able to have your doctor submit information to your health plan justifying why you need this service and why it's medically necessary. But it's also important to understand that your health plan does have services that they do not cover. Let's take a look at this example denial letter. And as you can see, there's a lot of information in this letter and it's very overwhelming. We recommend that you take your time reading through the letter, and we tried to break it down for you to show you what your letter will include. So let's go back to our example of Patrick. If you remember, Patrick is a 5-year-old who has autism and is needing ABA therapy. So this is the denial letter that Patrick's family received. As you can see at the very top, it shows the member information. It shows their ID, the date of birth, and the case number. It also shows who is the plan sponsor, which in this case, we're going to assume it's Patrick's mother. And then we show the account number. If you look below that where it says Dear Member and Healthcare Provider of Record, this is where they talk about how they made their decision. So in this situation, the health plan says what clinical guidelines they use to make their decision. Underneath that, you can see where it shows the dates of service that are being reviewed, the procedure code, which is the billing code that the provider submits to insurance to identify the service. In the next box, it talks about the service description. So here we see therapeutic behavioral services. This is also the term that they use for ABA therapy. And then we can see that they are requesting 6 visits of ABA therapy, and then the type of service is monthly. Underneath this, it shows us the actual denial reason. So in this case, Patrick's health plan denied this service because they did not get enough clinical information from the provider to determine if the ABA therapy was medically necessary. This is very important to know and understand because this will help you with the start of your appeal process. Step 3 is knowing your rights to an appeal. So now that we know the reason the health plan denied the service, it's very important that we know and understand the appeal timeline and the deadline to file your appeal. Please understand that there is a certain time frame when your health plan will accept a denial or an appeal from you, rather. If you miss that timeline, then most likely you will not be able to appeal it. So it's very important to find out those timelines for filing an appeal. You can find those out by reviewing them in your member handbook, or you can call your health plan to get this information. This is one of those situations where we would recommend documenting the date that you called, who you spoke with, and you can even ask them for a reference number for the call, which is a code that they give to the notes that they take pertaining to the call. You may also get the information for the appeals process on your explanation of benefits. This should be mailed to you, or you can receive it through email, and it will tell you the appeals process on it. The notice will usually tell you the deadline to file an appeal for the claim. And lastly, you need to know how to contact your health plan to start the appeals process. You will need to follow their rules and know how and where to submit the appeal. Every health plan is different. There are 3 different types of appeals that you can file. These are based on the time, outcome, and medical need of a denied service or supply. A pre-service appeal is before the service happens. You are going to appeal something if your health plan says, we will not cover that, we are denying that service for you. So again, that's before the service happens. Then there's a post-service appeal, and this is for services that have already been received, that you received a letter for afterwards saying that the health plan was not going to cover the cost. And then there's an expedited appeal, and this can be used if a regular appeal could take too long and put someone at risk, or put their life or long-term health at risk as well. So this is something you would do if you needed the health plan to make a very quick decision. So documentation is very important throughout the appeals process. We want to make sure that you understand how and what to document and the details that you should keep track of. We recommend that you keep a calendar to track dates. This is very helpful so that it makes sure that you and your health plan are following the appeals timeline. We have an example document that we'll look at in one moment that you can download from the DSCC website and use. We also suggest that you keep a contact log to track when you talk to different people. So this could be doctors, the health plan, or other people that are involved in your child's care. You can also go to the DSCC website and download a copy of an example contact log to use if you would like, and we'll look at that as well in just a moment. Being organized is important, and we think that it is a good idea to keep a folder for your supporting documents. This can be a physical folder, or it can be a folder on your desktop of your computer. It's your decision on how you want to stay organized. We recommend that your folder include documents such as medical records or letters from the doctor, letters that you mailed to the insurance company, and letters or documents from the health insurance plan that show the denial, the appeals timeline, and helps justify the case that you are building for your appeal. So as I shared, we have an insurance appeals calendar located on the DSCC website, and this is available for you to download and print off, or you can save it to your desktop. The nice thing about this calendar is we've left it blank so that you can use it for any month and put the dates in there to keep track of important deadlines, states that you made phone calls to your health plan, to your physician or other providers. And then you can also document any other things you've done. If you could put down the date that you mailed or emailed your appeals letter to the health insurance plan, because there is a timeline that they must follow as well as you. And then this is the insurance appeals communication log, and this too can be found on the DSCC website. And we will send you a link to this when we email out the slides to this presentation. But this log is very good because it's where you can keep track of dates, names, titles, contact information, and notes for phone calls that you've made to your health plan, to your doctor, to anybody that can help you with the appeals process. Step 4 is about getting your supporting documents ready. When you send an appeal to your insurance plan, it needs to have specific wording on why you are appealing. So you need to write a letter to your health insurance plan that says why you disagree with their decision and what you want the outcome to be. You need to be very straight to the point and specific about this. You will also want to get a letter from the doctor or medical provider, and this letter should say why the doctor supports your decision to appeal the denial. Any information that you can include with your appeal letter would be very helpful. So this could also include notes from your calls with the insurance company where you were provided with information. You can include medical reports that support the need for the service. We have also seen families include pictures of their child or even a video sent to the health plan telling them how this decision will impact their child if it's not overturned.
Okay. So now we're on step 5, which is to actually write the appeal letter, which might seem like, that's step 1 is writing the letter to submit the appeal. But as we've kind of talked about tonight, there's so many other steps that have to happen before you actually sit down and write the appeal letter that are going to really help you be successful in appealing the decision and hopefully get a favorable, decision where it gets overturned and the service or equipment is approved. So to write that letter, you're going to want to include a lot of different information, and we're going to go over that kind of step by step and look at some examples. But you also want to make sure that the letter is to the point and specific. You want to make sure that you're being clear about what you're communicating, that you're providing specific information as much as possible, rather than just like vague pieces of information saying, I'm appealing your decision that you made. You don't want to just say things like that. You want to make sure they understand exactly what it is that you're appealing. You want to tell them that you disagree with their decision and why you disagree. Tell them what result you want. So sometimes if you don't include in the letter, I'm wanting this therapy to be approved, or this medication needs to be approved, that kind of thing. You're telling them what exactly you're hoping to see happen from the appeal process. And then you also want to make sure you include a brief summary of other documents that you're going to include in your appeal packet, or whatever you're going to attach, so that they kind of know what they're looking at. It can often be a lot of pieces of paper, and what all those pieces of paper probably mean because you've compiled them all and you've put them together and you're the one sending them. But the person that's going to get them, whether it's in the mail or electronically, it's going to kind of have to make sense of the story that you put together and the case that you're trying to build and the information that you're trying to present. So kind of helping to lead people there can really help to make the whole story of your child or your own situation make sense to the person reviewing it. Okay, so now we're going to jump into some of those different pieces of information that we need to include in a letter. This is an example letter template that you can download off of DSCC's website. The first part kind of explains a little bit just general about the appeals process. So if you didn't go through this whole presentation, or you want to kind of reference just some quick tips and things, it has that on the first page. And then the second page and third page is actually an appeal letter, and it's an example, and all of the pink, red, purple, whatever color that looks like to you, text is information that you'll fill in, but we've kind of put a template together so that you kind of know what information that you would type in, kind of where to get started, because it can be really overwhelming to sit down and write an appeal letter because there's so much information that has to be included. And oftentimes you're probably really frustrated, right? You've been maybe arguing with the insurance about getting something approved, waiting on something for a long time, and it can be a really, really frustrating experience. So having a place of kind of knowing where to start and what information to include in the letter can be a helpful starting point. But this doesn't have to be the letter that you use. If you have, everything that you want to say, feel free to use your own letter. Or if you have another copy of a letter that you've used, this is just a helpful guide to help you include all of the important information. Okay, so the information that should be included, the first part of the letter is you and your child's information. So if you're appealing a decision for your child, you want to put you and your child's information in there and the policyholder's name. So if you're not the policyholder, but other parent is, everyone's information is probably going to be in the letter. You want to make sure that they know how to identify you. That's really the important part. So making sure the member ID, the policyholder, the group number, all that information from your insurance card is in there so that they can tell who you are, because there'd be nothing worse than sending all of this information in, spending hours on doing all of this, compiling all of this, and the health plan has no idea who you are and the letter went nowhere. So you want to make sure that they know how to find you when they get all of the information. And that's how they're going to find you, is by your name, your policy information, your group number, all that information on your insurance card. Next, you can include claims information if the services were already received. So that would be a claim number, date of services. Like Renee was talking about when we saw the example explanation of benefits, there's a big section that talks about claims information, and you can reference some of that information. If you don't know that information, you can also call your health plan. If the services were not received already, this doesn't apply, but this is only if you have received services. So that might be something that you include. It may not be something you include. And then the provider's name and the doctor's name. So, if the doctor who is prescribing the information is Dr. Jones, you're going to want to write Dr. Jones' name in there. But if the provider where the services are being received is different, you're going to want to make sure you include that. So maybe Dr. Jones put in an order for a wheelchair and you're getting the wheelchair from New Motion. You're going to want to include both of those pieces of information so that it's clear, who the different players are and where the information is coming from. So let's look back at our example with Patrick James. So this is the top of the appeal letter. So they have the date. Mom's insurance plan, remember, is through Aetna. So she has Aetna and the appeals and grievances department and the address. And again, this is where it's going to be specific to your insurance company. So you're not just going to copy this and put Aetna appeals grievances department. You're going to want to make sure you're referencing your own insurance information so it ends up in the right place. And you can reference your benefit handbook. You can call the member services line to get this information to make sure it gets to the exact right place. Then the member information is next. So mom put Patrick's name, his member ID, his date of birth. Mom put she's the policy holder, so she put her name, her member ID, and her date of birth so that the policy can be located. And then she opened the letter by saying, to whom it may concern at Aetna. So that's just the start of the letter. Next, when you really get to the meat of the letter, all the good information that they really need is going to be quite a bit of information, but it's really important stuff. And this is where you need to be as specific as you can. So the denial reason, you should try to word this exactly how they put it in the denial letter, and we'll show exactly what that looks like. But, when they send that denial letter saying, this service has been denied, this is why, you want to try to word it exactly like they did so that they're able to reference that information in their own system. Then you're going to want to include a history of your child's illness and the necessary treatment. Your doctor will probably explain this if you're asking the doctor to write a letter of medical necessity, or if they include some kind of, reports and things like that. But it can be important in there just to have a brief summary, maybe a paragraph kind of saying, this is my child, this is their illness, this is kind of the history of the things that they've tried, all that kind of stuff. What decision you're appealing, and you believe the decision was wrong. So that's an important thing to make sure you say that, this was denied. I don't agree with that. I would like this service approved, and make sure you kind of have a statement in there, because it may seem redundant, right? You're already appealing it. So of course they should know that you don't agree with it, but you want to just be as clear as possible and write as strongly as you can to make sure that you have the highest chance possible for it to get approved. Okay, so this is our example letter. Remember, this is Patrick James. He's 5 years old. He has an autism diagnosis, and the doctor has ordered applied behavior analysis therapy, and it was denied. And so that's the denial letter we looked at, and we're kind of writing an appeal letter based on that. So we're going to pretend in this situation that we're mom, Alicia James, and this is the letter she wrote. So it says, to whom it may concern at Aetna, my name is Alicia James, and I am a policyholder of Aetna. My child's name is Patrick James. I wish to file an appeal to Aetna for the denial of applied behavior analysis therapy, procedure code H2019 for my child. And again, that's not information that's supposed to be already magically in your brain. That was information that was from the denial letter, or it could be found on the explanation of benefits. I mean, believe me, like procedure codes do not live in my brain. They may live in some billing people's brains or some doctors' brains, but it's not information that you're supposed to just magically know. But knowing those tools that can give you that information is important. Okay, so she goes on to say, I received a denial letter dated 4/15/2023 stating coverage for the requested services has been denied because Aetna was not able to obtain any requested clinical information from the provider to determine whether or not the services are considered medically necessary under the terms of the plan. And this is not a quiz, so I'm not assuming that everyone remembers exactly what was on that letter, but that was the exact language that was on the denial letter that the family got. They didn't even have to, you don't even have to think about really exactly what you're typing right here. You can just copy it right from the letter. You're going to state exactly what the denial reason was from that letter. And this next section, mom kind of goes into a little bit of that history of her child's diagnosis and kind of what it is. So she says, my child was diagnosed with autism in September 2020. Autism is a severe chronic developmental disorder. Applied behavior analysis therapy can promote social and language development. This can help minimize behaviors that interfere with functioning and learning. ABA is considered by many researchers and clinicians to be the most effective evidence-based therapeutic approach for children with autism. So this is information that, you know, mom's not a doctor, she's not a medical professional, but she is just sharing some information about her child's diagnosis and kind of what she is, her understanding of what it is that the ABA therapy would do. She's going to rely on the doctor and the clinician's notes to really build that example of, you know, the technical terms about it, but she's just giving the person who's reviewing the letter a little insight to what it is. She goes on to say, Patrick is seen by Dr. Fisher at Good Family Pediatrics. Dr. Fisher has, I'm going to move my box up here, referred Patrick for applied behavior therapy at Best Therapy Center. So she says the name of who prescribed the therapy. So Dr. Fisher at Good Family Pediatrics. So that's his pediatrician. And says that he was referred for applied behavior therapy at Best Therapy Center. So that's where it's kind of important to be clear about the different providers and the different services. It may be one and the same, right? It may just be a service that Dr. Fisher is doing at Good Family Pediatrics, and that's what was denied. And if that's all you need to include, that's totally okay. But if there's multiple providers and multiple facilities in the mix, you want to make sure that you're including all that information. The therapist he sees is Jackie Smith. In the letter of medical necessity, which is included, Dr. Fisher explained why applied behavior analysis therapy is necessary for my child. I've also included other documents, including medical reports and evaluations that Patrick has had done to explain why this care is needed for my child. This is the only therapy of its kind. Patrick has been in occupational, developmental, speech, and physical therapy since he was 6 months old. He needs additional support with ABA therapy. Please review the included documents and reconsider the previous denial decision to allow coverage of ABA therapy as this treatment is necessary to my child's health. If there's any other supporting information you need to approve these services, please do not hesitate to contact me or Dr. Fisher, and she puts the phone numbers there. So really, she's not going into a super lengthy explanation of, you know, Patrick's medical history or anything like that. She's really just stating, you know, the facts of what's been done, why Patrick needs it, and what she's included that supports that assertion. Okay, and she says, thank you for your attention to this matter. Your prompt consideration to this appeal is appreciated. Sincerely, puts her name, her address, and then at the end says enclosures and puts, you know, the different documents that she included with this appeal. So denial letter, the letter of medical necessity from the doctor, medical records. You could be more specific with the medical records if you had, specific evaluations and things that you really wanted to highlight. And then documents explaining the procedure. So something that explains what ABA therapy is. And, of course, if you're writing this letter for a different service, you're going to kind of maybe include different things that would be more important. Like if it's a wheelchair, you might include like a seating evaluation or something like that. Or if you want a lift for your home, it would be helpful to include like the layout of your house so that the person who's reviewing this can understand kind of the dynamics of the home and why it is needed for, functional use in the home. Okay, so we just talked about everything that you should include in the letter. Now we're going to think about things that maybe we shouldn't do. So try not to talk about what would make it easier for the patient or caregiver. And I know that sounds terrible because everyone wants something that is convenient or easier or better for your child or for yourself. And there's no argument against that. But the insurance only wants to pay for things that are medically necessary, and they want to pay for the least costly item. So anything that they might consider a convenience item. So sometimes it's things that are like a fully electric lift. They're going to consider that pretty much all of the time a convenience item, because there's maybe a manual lift that can work and is functional, but is less convenient for the caregiver. So just kind of know that saying, well, I have a bad back and I can't use this item is not really focusing on the child and the child's needs. So you're going to want to make sure you're focusing primarily on the child's needs for the service and stay away from things that make it less burdensome for you or other caregivers. Try not to be vague. Remember, we said it's very important to be specific and clear as much as possible. General statements are not going to really build a strong case as to why something's needed. So just try to be as specific as you can. Do not miss those timelines when filing an appeal. If you miss them, you're right. It's gone. So you want to make sure that you're submitting in the time frame that your insurance says. And you want to make sure that you're submitting that letter and that you're well aware of those deadlines. We've talked about a lot of the different steps, and just learning about the appeal process and knowing about it is really helpful before you ever have to appeal something, before it's even ever on the table. You want to make sure you feel prepared about those things before you would go into that process. And again, can't stress enough, do not forget to include plan identification numbers. They need to be able to find you to process everything. I do not want all of your hard work, to advocate for you or your child to be for nothing. I really want to make sure that they can find you when you send this information to them. So make sure you include that information on there. Okay, and step 6, we're at the process where you would send the actual appeal letter. So you've done all of the writing, all of the gathering of documents, you know your insurance plan well, you've reviewed the denial, and you've drafted that letter. So you're really ready to send everything out. So again, pay attention to that deadline. Mail your letter certified if you can. That'll give you proof that you sent the letter in before the deadline, so you'll know that it was sent on time. Make copies of your appeal packet. So whatever you're sending into the health plan, make sure you keep at least one copy for yourself. So if something gets lost in the mail, or if they're calling and referencing certain parts of the document that you've put together, you have it on hand to be able to, say, okay, page 3, this is what it said, this is what they're talking about. Remember, you can request an expedited review of your appeal if a treatment or procedure is needed right away, like if it would be life-threatening or harmful to you or your child's health, for it to not be considered right away. And if you get your insurance through your job, one helpful thing that you might have access to is help from your employer's human resources or benefits department for an appeal. So that just might be something that you want to reach out to your employer about if you need to appeal something, just to see what resources they might have. Okay, I'm going to turn it back over to Renee to kind of talk about what happens after you submit the appeal letter, kind of how you follow up on it, and what an external review is.
Thank you. All right, so you've done all this work and you've submitted the appeal, and you think, oh, now I can just sit back and wait. No. Follow up, follow up, follow up. That's very important to stay in contact with your health insurance plan until the decision has been made. Also, while every time you speak with them, you talk to someone, make sure you continue to keep documentation of every time you call, every time you checked on the appeal. If the appeal is denied, you can file a second appeal. So don't get discouraged. All is not lost. And it just include additional information, not the same information, but some additional information that you did not include in the first appeal. Or you can ask for something called an external review. An external review is an appeal that is completed by someone outside the health plan. This appeal can be done if the internal appeal is denied by the health insurance plan. Now, what they do is they would use a physician who is board certified and in the same specialty as the participants or the patient's physician. The health plan will give you the choice of 2 independent reviewers. They do not work for the health insurance company. The reviewers are from the Illinois Department of Insurance. You and your provider can choose which one will do the independent review. Okay, so after this, if the external appeal was a post-service appeal and it is won, yes, celebrate. But as well as the health plan will be told, and the treatment or claim will be processed as approved. So yes, that's great. If the external appeal was a pre-service appeal and is approved, then the health plan will be told and the approval will be given for the treatment. So you can go ahead with the service. The external appeal request, if it is denied, you can appeal the decision of the independent reviewer with the Illinois Department of Insurance. If the Illinois Department of Insurance changes the independent reviewer's decision, they will require the insurance to pay for the treatment, the claim that they submitted. The health plan can appeal the Department of Insurance decision, and a new independent reviewer will be assigned to review the case. The decision of the independent reviewer can be appealed. Again, all is not lost. You can appeal that as well. The complaint will be sent to the health plan, and according to Illinois law, it allows 21 days for the health plan to respond. Now, here are a few links and things that you can use to get in contact with them, the Illinois Department of Insurance and the Illinois Attorney General contact. So again, first, work with your provider. Let's go a little bit of a summary here. Work with your provider and your health insurance plan. And then here are some of the links. Okay, and then the appeals article for healthcare.gov, glossary of words for healthcare.gov, navigating the insurance appeals process guide for Patients and Advocate Foundation, guide to appeals for health and law and advocates, and then also here's a sample insurance appeals letter template. Okay, and appeals can result in a change decision. This can benefit you and your child greatly. It is important for you to keep detailed documentation, as Amy spoke about, as I talked about as well, during all the steps of the appeals process. It is important to keep track of deadlines for the appeals as well. You know, it'd be terrible if you miss the deadline. So yes, keep up with that because they're sticklers about that deadline. You should work with the providers or others that can help to get all the right information for the appeal. So remember, work with your insurance plan, work with your provider, work with the hospital social worker. If an appeal is denied, you have other options.
Okay, we realize that we are running a little bit close to our time of ending, but we did save a little bit of time for questions. And I do see that we had one hand that was raised. Let's see, maybe not. I think, okay, I think maybe she put it down. If you did raise your hand and still want to ask your question, please let us know. But if you can, please use the question and answer box for your questions. And like I said, if you want to raise your hand, we can unmute you. I'm going to go ahead and we have 3 questions right now. So the first question is, does the Illinois Department of Insurance have the ability to support instances where there's privately funded insurance plans by the company from out of state? Or is that only covered under federal insurance policies? Brittany, I'm going to see if you know the answer to that.
You know, I'm not sure, and I don't want to answer on what the Department of Insurance would do, but what I can say about the Illinois Department of Insurance is they're very helpful, very quick to respond. So if you did reach out to them about a question, they're going to get an answer back to you pretty quickly. So I'd say if you have any concern or questions or issues you want to bring up to them, I'd say just bring it up to them regardless, and then just see what their answer is. It never hurts to at least attempt. And that way they'd be able to give you direction and say, hey, this is not something we're going to be able to help you with. And they'll probably give you the resources of exactly where you should go. And that way you're not going a bunch of different places.
Thank you. The next question is, who is the person reading the appeal and deciding if the denial is overturned? And this was with when we were discussing sending the appeal to the health plan.
So it would be someone at the health plan initially, it'd be someone reviewing it from the health plan. If they deny it or they uphold that it's denied and you go to the external review process, that is an independent reviewer separate from the health plan, but the initial appeals process goes to the health plan.
We have a question that says, what can you do if there is a waiting list for a service?
That's a good question. And I think that answer is kind of tricky because waiting lists for services are due to provider issues, right? Like the provider doesn't have enough capacity to serve the amount of people that need the service. So they put everyone on a wait list, or in some instances, financially they say, well, we'll take, X amount of Medicaid participants because Medicaid pays at a little bit of a lower rate, but they'll take, however many private insurance people. And so sometimes it just depends on, your insurance and the provider's ability to serve. One thing I can recommend, and Amy and Renee, if you have any other suggestions, jump in, is that if it's a provider issue where you have no in-network providers that are able to serve you and the wait list is very long, you can ask your provider to make an exception for you to go to an out-of-network provider, give them some medical justification, kind of similar to an appeal, but it's not actually at the appeal stage. It's kind of like a prior approval where you say, hey, this is the situation. This is what my child needs. This is the consequence if they don't get this. Can you consider, this service? But I think it's just something, unfortunately, that a lot of people are dealing with. And I think it's just a capacity issue with the healthcare systems.
We have 2 more questions, and I know we're close to the 7 o'clock mark. So can a self-funded plan deny something that is mandated by state law? For example, ABA for kids with autism.
They sure can, unfortunately. Self-funded plans don't have to play by all the same rules, which is why some of those laws that you see come out, like hearing aids that have to be covered, or things like ABA therapy for kids with autism, self-funded plans don't have to adhere to those. So chances are it didn't apply to them. It seems like it applies to the fewest number of plans possible, unfortunately. But you can still, work with your insurance and try to see what options exist. But yeah, your self-funded plan, unfortunately, is a situation where there's just not as much options.
Thank you. And then are all of the reviewers doctors? Do they use people like therapists during the review process?
That I honestly don't know. I think you'd have to probably ask your specific insurance company what they use. My guess is it's someone from their utilization management department, which is kind of the keeper of who can have services or not. And I'd say there's usually a medical person on staff in those types of departments. But everyone reviewing it may not be a medical professional. But I think if you have specific concerns or questions about who may be reviewing it, I would definitely consult with your health insurance plan. Likely a doctor is going to be involved in making the decision, but I can't say that there's going to be, all these specific types of specialties and therapists on staff at a health insurance plan. That seems maybe a little too good to be true.
I know.
And we have maybe time for one other question. And then if we didn't get to your question, I can try to follow up with some people, or you can send us an email. We'll kind of explain how you can email us.
So let's see, really quick. I'm doing a second appeal and I'm trying to understand the point system because they are basically saying that my child is not disabled enough. He is completely dependent and I'm really not sure the best route to go.
I think for that situation, if you feel comfortable, if you'll use the email that we give at the end, I would like to review that situation a little bit more specifically and give you a little bit better direction. I know obviously only in, the context of our conversation, you can give some general information, but I think that might be a situation where we're better able to help you if we had more specific details.
Yes. And then I did just send a message to someone with another specific question.
Okay. Yes. Same thing. If you have specific questions, feel free to reach out, and I guess I can advance the slide so we can go there.
We just want to thank you for joining us tonight. I know it's beautiful outside and you had probably other better things to do, but we're glad you sat in here with us and just went through the appeals process. Like we said, we'll email the slides to you. And they'll also be posted at this link on the DSCC website. We did record the training, so it will be posted on the website as well. And then one thing we ask, and it won't take very long, but we would greatly appreciate it, is if you would complete the survey at the end of this training. Your thoughts are very helpful and important to us, and they also help us with deciding on future trainings. We also would like to know if there are any other topics you would like to have a training on. And then this training is part of a series of trainings that we just are finishing tonight called the Health Insurance Education. You can review the other trainings and recordings on our website. In March, we discussed understanding your insurance. In April, we went through Medicaid eligibility and coverage. And then tonight we discussed insurance appeals. The link to those webinars is listed here. And when we email out the slides, you'll be able to access it directly. And then here's our contact information. So if we weren't able to get to your question, or if you had a question and just weren't able to ask it, we would encourage you to email us, or we also have contact through the 1-800 number listed. And then we have a link to our website. And then also we have a Facebook page that has a lot of great updates and posts that we share. Thank you again and have a great night.
Good night, everyone.